Hello everyone and welcome to the Highlights collection. We're so pleased that you could join us today. I'm Maya Potter, the Events and Digital Community Officer at Target Ovarian Cancer. Today's event is slightly different from our usual wellbeing sessions, as we have handpicked the best bits from our events from over the years, from clinical psychologists to complementary therapists to practical tasters. We hope that in today's session you'll find support that suits you. So with that, we will start our first session.
Is it normal to have anxiety post a cancer diagnosis? You know, if we were here in reality, I'd pose this to you, and having just said I've delivered this quite a few times, I pose this and I say, is there anyone in the room who doesn't suffer from anxiety? And I would say that again, and absolutely, you know, anxiety post-cancer is absolutely natural and normal, because the formal definition of anxiety is that it's a feeling of worry, nervousness, uneasiness about something with an uncertain outcome. So knowing that we've had cancer, it was never in our life plans for most of us, unless it was a genetic risk, in which case it may have been in your periphery. But for majority of the patients, it comes out of the blue. So having had the diagnosis, having had the treatment, whatever the treatments have been, even for patients who've completed treatment, so whether that's 6 months, 6 years, 16 years, 20 years, the uncertain outcome is still there. Because knowing that we have anxieties from caveman days, is it any wonder that we have uncertainties? Bearing in mind, your mind's eye is trying to protect you, safeguard you from dangers. And so this is your mind's eye now making you aware that actually, let's be mindful that recurrence fears can arise, that recurrence can happen. So it's just trying to protect you by flagging it up, okay? And it is very, very natural for all cancer patients. It doesn't matter which cancer site they're from, whether that's ovarian, breast, prostate, recurrence fears are there for all cancer patients. Because we've lost trust in our bodies. We were living in our bodies for decades, depending on how old you are, and we trusted our bodies. And almost we feel let down, okay? So we lose trust in our bodies. We lose trust in the world around us, because your mind's eye is desperately trying to make meaning. Why did I get this cancer? So, and because there are no definitive answers, we lose trust in ourselves. Okay, and again, I'll come back to that in a minute. Your mind's eye becomes heightened with that anxiety because, again, remember, over decades we've learned to see ourselves in a certain way in a mirror. We know who we are. In our mind's eye, we know who we are physically. Post a cancer diagnosis, post the treatments, we will have changed in terms of our hair might be different. We might have lost our hair. When hair comes back, it may have come back in a different texture. We may have lost weight. We may have gained weight. Again, all of this, when we look in the mirror, it becomes heightened because our mind's eye becomes heightened because I don't recognize the person I am. So naturally, it creates anxieties. Fatigue. Again, if I was in a room with you physically, I'd say, who doesn't struggle from fatigue? And, you know, for people who don't understand fatigue, it goes post-tiredness, doesn't it? The light just switches off. And, you know, some of the ways in which I've had patients describe fatigue is the mind is willing, but the body absolutely says no. Okay, there is just nothing left. So that's that fatigue. And again, I'll come back to that in a moment. We have, over recent times, lots of celebrities raising awareness of cancers by naming their own cancer diagnosis. I've just named George Alagaya. And it's really interesting. You know, we often use TV as a means of escape. But often now what we find is when we switch the TV on, or you'll be flicking through a magazine, your mind's eye seeks out all of those cancer stories. And it's not that you are attracting all of these cancer stories. It's just our mind's eye has developed a cancer antennae that it just does. It just sees it everywhere. Because, you know, if I bring it away from cancer, if you think about that one dress you wanted because of that color, or you buy a new car because it's just so different, you buy it, and then what happens? You see 10 of them. Okay, so it's just that your mind's eye becomes used to seeing that, so it will notice it. Okay, so yeah, it makes it really difficult knowing that wherever you're turning, it's there. Almost our mind's eye is still heightened. It will relax over time. It's just that it is so heightened right now that we're noticing it everywhere. And you know, from a very, very young age, we've been brought up with dates, haven't we? Don't forget your birthday. Don't forget my birthday. Don't forget my anniversary. So we've been shaped to remember dates. So if I said to you, date of diagnosis, date of start of treatment, date of end of treatment, all of these become imprinted in our mind's eye because this is how we've been shaped. Again, if you take away nothing from today, acknowledge those dates to yourself. Okay, some people choose to make a big event out of those dates, so almost this is my second chance, and they'll throw parties or they'll do something big. What I would say is, if that's not you, at least acknowledge it to yourself. If you don't, your mind's eye will trip you up in the day, whether that's tears streaming or whether we become irritable, just sad, and actually I don't know what's going on today, I just don't feel like myself. Okay, so please acknowledge those dates to yourself. Again, post a cancer diagnosis, if I say pre-cancer, think about all those roles you were playing. You're a mum, you're an employee, you're working, you're doing lots of physical activities, you're a friend, you're a daughter, you have multitude of roles that you had. Cancer comes along and almost all those roles become redundant, don't they? And we take up that cancer patient role. Okay, post treatment, what I would really encourage is let's pick up some of the other roles that are so much more meaningful, so that cancer and being a patient doesn't become the only role. It becomes one of the smaller roles that we still need to play when we have appointments. But otherwise, pick up the role of wife, pick up the role of being daughter, pick up the role of being a mum, pick up some of those roles that you choose to pick up. Something else that makes our minds very heightened is those appointments. Okay, so you will know whether it's that brown envelope, whether it's that white envelope, depending on the hospital that's tracking you, if that envelope already falls on the floor. We get that anxiety, okay? And it's interesting, isn't it? It's a double-edged sword. So as much as we don't want appointments, if we don't have those appointments, then we become anxious. It really is that double-edged sword to say, nobody's following me up. And it becomes that thing, doesn't it? You know, as much as we never wanted to have treatment, we get used to having those treatments. And when we start our treatments, depending on how long they've become, habits form so quickly that when we come to the end of treatment and they say, you have no more treatment, actually, that's my safety net. I still want to see you. I want more scans. At the beginning, you start with, I am sick of hospitals. And then we come to that place of, I want more hospital appointments. So it really, remember, your mind's eye will argue with you regardless. Okay? It's what it's shaped to do. Whatever you say, it will argue with you. Give you an example, away from cancer. If I say apple, what did your mind's eye say? Possibly pears, oranges, something different. It will always flag up the alternative. Your mind's eye is not made to agree with you. Okay, so recognize that you're not alone in this. This is what our mind's eyes are made to do. again, they argue with you because it's a part of the anxiety cycle to make you aware of what you might be missing. It's just what your mind's eyes shaped to do, to flag up the alternative, to say, don't forget. Okay. So we really, really need to learn to live with these uncertainties that we're faced with. So your mind's eye, again, like I mentioned, is desperately trying to make meaning. Why me? Okay. Often hear this from patients. And you know that why me? There is no definitive answer to that why me. Then, you know, as much as research has come so far forward, there is no definitive cause equals cure. If we knew a cause, we'd be closer to a cure. There are things that can make you more susceptible to cancers, i.e., diet, weight, alcohol intake, but there are no definitives. And again, this creates that unjustness because you will know people in the world who will have the most unhealthiest of lifestyles who don't have cancer. Okay, so instead of investing all of that energy into the why me, I would say take control of it and say, how do I move forwards with this now? Okay, in terms of taking up some of that well-being, in terms of looking after yourself. So, you know, let's not go crazy with the physical activities or the diet, but let's just think about taking some of that control. And you know, for us as cancer patients, once you've had cancer, almost we get these cancer tinted lenses where we are choosing what we want to focus on and what we don't, because you've lived with that existential crisis already as soon as you had the diagnosis. Because as much as you don't want to think about it, what happens in the millisecond of diagnosis is your mind's eye goes to that death thinking. And in that millisecond, we've already planned our funerals, okay? Before we get jolted into, these are the treatments, this is what we can do. So almost is that existential crisis that creates that anxiety too. But you know, we've been living with this existential crisis all our lives. So if I said to you, what's the meaning of a birthday? Okay, often I'll have patients saying, it's a day of celebration, it's a day of rejoicing, partying, doing whatever. And you know, there's a really morbid way of looking at it. It's a year closer to death, isn't it? Okay, knowing that I teach this, knowing that I say this, I can't bring myself to say, kids, I'm dying daily, you're dying daily, and I'll see you later. It just makes a mockery out of life. So what, as human beings, we can't do living and dying together. So we flip it onto its head and we say, we're doing the living. Okay, and post a cancer diagnosis, it's that we keep being pulled to between the living and the thinking about the planning for the dying. We can't do it, okay? But this is to say, it's nothing new. We've been living alongside this all our lives. We've just chosen to focus on doing the living. And that's where we need to get to again. So it's that existential question. We do have those cancer tinted lenses where post a diagnosis, we're not bothered about whether the bins are put out or not. We're not getting cross with our loved ones about that. It's just a minuscule thing. We're not bothered about having arguments about people jumping queues or whatever, because you've noticed there's a bigger picture in life. So we do need to retake doing the living, and a part of doing the living is planning for the future. That's what it gives us. It gives us hope. Post a cancer diagnosis, I hear a lot of patients saying, I can't go too far. I don't want to go abroad for holidays when we could go abroad for holidays, or I don't want to go too far away from home because I've lost my confidence. I need to be around the hospital just in case. So we either become stuck, completely stuck in terms of not moving forwards, or I've had patients who become hyper alive. So they'll be booking when they could their 5th and 6th holiday abroad. Okay. we can't manage that level of being alive either. We need to find that in between again, from being stuck to being hyper alive and being, just how you need to be in the middle, taking each day as it comes. And it's that impact on our loved ones as well, because that becomes that double-edged sword. As much as they were concerned about you when you had the diagnosis, almost they may become overprotective now and want to take away all your roles. So don't do the vacuuming, don't do the cleaning, don't go to work. I would say take back some of those roles. If you choose to, if you want to give up the vacuuming, give it up. Don't do that again. But almost in that deciding which roles you pick up, once you pick those up, they might go the other way as well. You'll find now. And again, for us, it's that double-edged sword, isn't it? Post a cancer diagnosis, I want to be fine. I want to be normal. I don't want people asking me about cancer all the time. And yet, when they ask, I don't want them to remind me. So it's, again, a real double-edged sword. There's no rights or wrongs. It's just how we feel in that moment. We need to regain our values to what matters most to us. Again, another analogy, if we feel like cancer is chasing us, you're constantly looking back for that zombie. Your focus is in the past, it's not in the here and now. If your attention almost is in that rear view mirror because you're constantly looking back because of the cancer, we're not focusing on where we headed. In moving forwards, don't try and move too far into the future, because that in itself will create anxieties because we don't know the future. Your mind only knows the past. So bring yourself to this moment, in the here, in the now, present moment awareness. And if you're investing all your energies in getting there, away from cancer, because I need to reach that milestone, 5 years, 10 years, whatever it is, what are you missing in between? What are you not noticing? It makes you aware of how you can bring yourself right in this present moment, okay? So that you can take choice, you can make a choice of what's important to you. So mindfulness, often we think of sitting in a Zen-like state. It doesn't have to be, okay? We can use our 5 senses. So what can you really see? What can you really hear? What can you taste? And we can use mindfulness in that sense. Think about using other strategies as well, including distraction, relaxation. That can help you cope in the here and now. How we manage with fatigue, it's choosing what you want to do rather than what you need to do. So if you want to spend time having a coffee with a loved one, do that instead of needing to do the household chores. If you can, do it in bite-sized chunks so that you're pacing throughout the day. Okay, do a little bit, stop, have something to eat or drink, and then restart again, do a little bit more. Think about taking control of the diet and the physical activities that I spoke about. So that doesn't mean to say that you go on a cancer diet, because there is no such thing as a cancer diet. It's just healthy eating. Okay, think about the physical activities in terms of just being a little bit more active. Think about planning for your future. Future can be later today. Let me see if I can make that call to that friend that I've been thinking about. The last point, sexual relationships. It often doesn't get talked about, okay? Knowing that cancer impacts on our identity, sexual roles have often been quite crucial for couples, regardless of what sort of couple makeup that might be. If it's an issue for you, please let one of us know so that we can put you in the right, in touch with the right people who can help, because often you will have sexual health counselors as well who can help. Okay. Wanted to flag up this circles of control, because often what we think is that we can influence and control for everything. Absolutely not. The circle in the middle is who you are. You can only control for you. Things outside of you is stuff that you can influence. So we can only put healthy meals out on the table. We can only suggest, let's go for a walk with our children or teens, knowing that they will make their choices. we can't make them do anything. The outer circle, the very outer one, is often stuff that engages your mind, but often things that you cannot control for at all, including recurrence. The only way you can deal with that recurrence fear or that uncertainty is, again, bringing it back to yourself and choosing to live a healthier life. That's, and attending for your appointments. That's as much as you can do. Okay. Again, just the last slide in terms of asking about questions that might help you make this differentiation between what's helpful and not. With thoughts, is this thought helpful in any way? Is it an old story? Have I heard this one before? Most probably. What would you get from buying into this story? Often very little, because it will be your mind's eye just babbling on. Does this thought help you to take effective action? If it does, great. Often it will keep you trapped. Are you going to trust your mind or your experience? I would say go with the experience.
This is not an exhaustive list. There are lots of things you can do. I've just tried to give some examples as a starting point of things you can try, which are designed to activate the soothing contentment system. And everyone's different, and you'll all have your own ways. Some people will be very well practiced. You may be doing things like yoga already, or Pilates, and these are naturally very mindful activities which activate the soothing contentment system. The science shows that how helpful that is. But some of them, sometimes if you're not used to kind of doing things, or you're feeling very stressed, it can be very difficult actually to then jump into deep, long relaxation exercises. So the one I'm going to try with you, you can just sit and watch me do it, or you can do it with me, is something called dropping anchor. And it's a really brief exercise, but it can be really helpful when you are trying to go through something. When you're trying to go through, when you're going through something quite stressful, it involves about 6 steps. It's really quite simple. So the first step is literally just pushing your feet hard into the floor. And just feeling the ground beneath you. And now just sitting up in your chair and just noticing how you're sitting. That's all you need to do, is just noticing how you're sitting. And then just looking around the room, just noticing what you can see. Just noticing what you can hear. And now just noticing what you're doing right now. Just listening to me talking. Maybe you're on your laptop or on your phone. Just noticing where you are, what you're doing. And now just taking a few deep breaths. And what I want you to do is just see if you can breathe down into your feet. Just keeping your feet firmly pressed into the floor. Just noticing how your mind keeps trying to pull you somewhere else. And just see if you can stay present. Just noticing the room around you. Just noticing what we're doing here right now. So very brief exercise can be a very good way of stepping out of what we call autopilot. When we're going through something really stressful, anxiety-provoking, difficult, if it's surgery, if a loved one's going through surgery, with the great example there, or waiting for results, or finishing treatment and feeling out of sorts, our minds can be just awash with all sorts of thoughts and thoughts. Physically, we can be feeling it. And what can happen? We can get in these vicious cycles. And sometimes just taking a step out it can feel counterintuitive. Like I said earlier, a lot of problems in life we want to fix, we want to sort out. But with cancer treatment, for you or a loved one, sometimes a good first step is just stepping out for a moment and dropping anchors, literally just dropping that anchor, just being here and now. I can, it's one of the first exercises I often try. There is a psychologist called Russ Harris who actually did the video I've just seen, and he often advocates, he's written a book called The Happiness Trap, and he talks about this as well. And it's something I use in my sessions a lot with people, often in a first session when they're feeling overwhelmed, just as a first step. The next recommendation could be breathing exercises. They're not for everyone, and if, for example, you've experienced panic attacks before, or I would be careful of how you do these. But on our Maggie's website, if you type into Google Maggie's Centres Relaxation, we have some very brief ones which actually work really well. Some are for a couple of minutes, some are 10 minutes. But it might be worth just giving that a try, seeing how you feel with them. Again, these are both designed to activate the soothing contentment system. They're mainly focusing on the physical, but when you focus on the physical, sometimes that can give you that anchor. So when your mind is rushing away, focusing on your breath or even your muscles. So the next example is deep muscle relaxation. Again, on our Maggie's website. Working for Maggie's, these are the ones I'm most familiar with, but I'm sure if there will be others available as well. But deep muscle relaxation, it can be a really nice way physically, helping your muscles feel more relaxed. When the threat system's activated, your muscles will be tense. Sometimes we just get used to it. I know when I'm working on a desk, I don't realise how tense my shoulders are, or after a while, you just become habituated to it. And sometimes with surgery and things, our brains doing what they're designed to. We feel tense, we feel we're in pain, and so ways in which to help relax our muscles can be helpful. And the Maggie's website, it's a very brief one to start with, but it's quite a safe way to try it as well. Obviously, if you're in pain in a certain region, then it's important to kind of see what the medical professionals say. But sometimes targeting the physical as a first step can be a really good way of activating soothing contentment system. The next is nature. Occasionally, I do see people, and we try some ways in which some of the more formal relaxation or mindfulness exercises as a first step, and they don't get along with them. Some people feel really tense and stressed and struggle just to sit and doing an exercise, and I can completely understand that. But sometimes walking in nature can be a really good first step, because you can still keep active if sitting and being is a real struggle for you at that time. But also you can feel more in control with that. So if you're going somewhere, even if it's just a 5-10 minute walk, and if you're struggling with motivation, just tell yourself, right, I'm going to try this for 10 minutes. I'm going to go for a walk in a local park for 10 minutes. And if it's after 10 minutes, if it's awful, I'm just going to come back. But just see what happens. And sometimes when you go for that walk, be aware of the breeze on your face. You can have a look at how the trees are swaying in the wind, or the colours of the leaves as they change as it's autumn. Those kind of things. That's all. That can all activate a soothing contentment system. And it's all actually mindfulness activities, which I'm going to talk about now. Mindfulness has been a bit of a buzzword, and it isn't for everybody. I run a mindfulness course here at Maggie's Cambridge, and I have my biases with it. I practice it myself as well as part of my training, and And for some people, there's real benefits. For those of you that don't know, mindfulness is a non-judgmental, present moment awareness of the here and now. And research has shown that for those going through cancer treatment, and a lot of the research focuses on people post-cancer treatments as well, that it can be very helpful in reducing feelings of anxiety, worry, and low mood. I know it's not for everybody, but any activity can be mindful if you're in the here and now. It doesn't have to be sitting doing long meditations. Like I said earlier, walking in nature, being looking at the leaves, the way they turn, looking at how the wind blows the trees. All these are mindful activities. You're in the here and now, focusing on something. And when your mind wanders about worries, just bring it back to what's around you. And also key is part of this, I feel, is self-compassion. The soothing and contentment system is activated when we're kind to ourselves, when we receive compassion, when we give compassion to others as well as ourselves. By undertaking any of these examples, these are examples of self-compassion. We as humans, we're really good at helping others. We're very good at being compassionate to others. We're not so at ourselves. So sometimes if you're having those self-critical thoughts, those thoughts that I should be doing better than this, I should be coping better than this, often they originate from the threat system. It's the anger towards ourselves. And sometimes it can be helpful to just take a step out and say, well, what would I say to a friend or somebody else on this ovarian cancer community who's going through the similar circumstances to myself? Often you'd say, I'm sure you'd say a lot of the right things. You wouldn't give other people the judgment and criticism that we often give ourselves as humans. It's part of being human, and often the vicious cycle is the more stressed we are, the more prone we are to self-criticism. And self-compassion is really important. And that doesn't have to take the form of looking at your thoughts or feelings. It can be, well, what is important for me right now? I know it's a cliche, but if that lying on the sofa, doing a jigsaw, having a cup of tea or something will relax you more than doing another task. Then actually, if you're a loved one that's gone through cancer treatment, ovarian cancer, more than likely you deserve that. And that can be the form of self-compassion, doing that, putting yourself first. The activities may help with your emotional well-being. I would strongly suggest that actually that's really therapeutic. You may have those thoughts that I'm being self-indulgent or whatever. Often they originate from the threat system, but in order to activate your soothing contentment systems, it's really important to put yourselves first. And yeah, another take-home message: self-compassion. If you take anything from this, that's another take-home message I'd really strongly advocate.
So let's talk about what integrative oncology is. You may or may not have heard it. So integrative oncology, or integrative cancer care, is integration of evidence-informed conventional treatment with the psychological, nutritional, lifestyle, and evidence-informed complementary therapies to support better quality of life, improve resilience, minimize the side effects of treatment, and of course, support clinical outcomes. So it's really important to realize that integrative oncology is not in any way sidelining conventional treatment. It puts it at the front and center. But we also recognize that just receiving chemotherapy, radiotherapy, surgery, and other treatments makes us have a significant knock to our system, and we need other supportive approaches for us to be able to maintain resilience. Sometimes the side effects of treatment can be quite debilitating. We definitely want to have the best support available for us to be able to tolerate treatment as per our medical team's advice. The two key organizations that we have for professionals within integrative oncology is the BSIO in the UK, and that's the British Society for Integrative Oncology, And SIO in the US, it's an international organization called Society for Integrative Oncology, and has a number of different clinicians within that space. So if you do find that maybe a member of your clinical team is interested, or you might want to be an expert patient who's interested in this, then joining some of those organizations can be a really great way of learning more about it. So BSIO is the leading professional organization for integrative oncology in the UK, and our goal is to promote the practice of integrative oncology in cancer care. Now, our vision is that it should be readily accessible to anyone affected by cancer in the UK. And the way we do it is that we aim to improve cancer care by really supporting healthcare professionals, both who work on the NHS, from oncologists, nurses, GPs, allied healthcare professionals, all the way through to people who practice privately, for example, those in nutrition, maybe herbal medicine, massage, etc. We want to support interdisciplinary communication, so that's everybody talking to each other, because funnily enough, that doesn't always happen. And it's really important that we all talk to each other and collaborate, so that you, the patient in the middle, don't have to do so much hard work. You don't have to do so much integration. And everybody unites behind the goals that you have. We also aim to provide educational resources with all the up-to-date evidence, so that your clinicians can actually understand integrative oncology and are able to support you with that. And of course, we also want to promote the research needed for effective care. So why on earth bother with integrative oncology? Well, I feel that it offers us a sense of agency and empowerment. Certainly feel that way in my clinic, where we're actually supporting resilience versus the space where you get told you have a diagnosis, and actually you are hit with, oh my goodness, I've got to go through this whole roller coaster of treatment. And sometimes you just get told to go home and rest, or there's nothing you can do, we're going to take care of it. And I feel that we all have a role to play in our health and well-being, wherever we are in our treatment pathway. So to me, integrative oncology offers us an opportunity to take actions every day that we can do to support ourselves. It also sees the whole person, not just the cancer. And sometimes, I know in the medical system, people sometimes feel they're just seeing this diagnosis, is that, whatever it is, stage 4B, FIGO classification, etc., etc. We want to be able to support and see the whole person and their families and their loved ones, and support the whole ecosystem to be able to get the best for you. Integrative oncology offers an expanded toolkit. It means we have more things that we can do to appropriately self-manage sometimes when it's simple enough, but also to receive professionally guided support when we really need it, covering the whole spectrum from cancer prevention to living well with cancer. We want to be able to actually use the best of the toolkit, not just medications, but other things that we can do to support ourselves and minimize side effects and minimize what we call polypharmacy, lots and lots of medications, the growing list of medications that all come with their own side effects. We want to have the best of conventional treatment, but also the best supportive treatment as well. And multidisciplinary care has been recognized as really important. This is a diagram that's actually from a conventional cancer journal that shows you all of the hospital professionals that are involved, gynecological surgeon, oncologist, pathologist, but also, funnily enough, also brings in the nutritionist. Now, what I'd like to also see in here, apart from this, is, of course, the physiotherapist, the exercise rehabilitation specialist, and other people. But they already said that actually more than just a few people are involved in this. And the more people are involved, the more the integrated approach can actually benefit the person. So they feel they're supported from all the different angles, not just looking at one aspect of it. So what do I feel integrative oncology is or should be? Well, it should be that rational integration of the best of all worlds, right? That's what we are seeking. It should be whole person oriented and address all our needs, physical, emotional, mental, spiritual needs. It should support targeted and personalized medication use where necessary without over-medicalizing everything. And it's about caring for people, not mindless protocols. And you can get all sorts of weird and wonderful protocols on the internet that people have used. And sometimes there's this assumption that because it's helped one person, it's going to help everyone else. And to me, integrative oncology is about seeing the whole person, seeing where they're at that moment in time, and combining the best available research evidence the person's clinical experience, and also your values. What's important to you need to come into it. And it does need to be intensely personalized because of the safety margins we have with treatments like chemotherapy, for example, as well as targeted therapies. We need to be careful about what we do. So as a starting point, I really want to talk about the 4 foundational pillars, and that's nutrition, physical activity or movement, sleep, and psycho-emotional support. And the reason I start here rather than going straight into the complementary modalities is because, to me, anything you do on the complementary side has to land on this solid foundation. And it's really important because that's how we get the best results out. Sleep is, of course, really, really important, and it gets affected not only by the whole stress of diagnosis and treatment, but also some of the drugs that we get given when we go through chemotherapy. So, for example, we might be able to talk to our teams about trying to keep our steroids as low as possible, enough to provide the treatment cover, but maybe not too much if it's really affecting our sleep. We might want to consider, or at least our GPs might want to consider, things like melatonin, for example, instead of what we call the Z drugs. And there are things like zopiclone and zolpidem that quite often get given to us when we are in hospital, but they are addictive. So therefore their use is quite often minimized, but of course people still need sleep support. There are some really good complementary therapies that have been well evidenced for sleep support, and that's CBTI. So that's available in the NHS, usually via something called Sleep Station. Now there might be differences about regional access, but it's still worth a try. As well as mindfulness-based therapies, Qigong and acupuncture, they tend to have the most evidence. But yoga, acupressure, massage, and reflexology also have up-and-coming evidence. And what I've shown here, I've put out just one trial that was a yoga for cancer 4-week program that significantly improved sleep quality, and also that grogginess you get in the day when you've had really, really poor sleep, which makes everything so much harder to deal with. Psycho-emotional support is, of course, essential as well. And I feel, and I think it's important for all of us to realize that PTSD, or post-traumatic stress disorder, is not just a diagnosis that can happen when you're in the war zone or when you go through a horrific road traffic accident. It's really important to understand that actually a significant proportion of those who are living with cancer or cancer survivors can have PTSD symptoms. And if you're concerned, please go and see your GP or your medical care team, because it really needs to be treated appropriately. Generic counseling will not work for trauma therapy. Okay, it's really, really important to realize that. And some of us may have struggled with some of those symptoms and have gone to see someone for counseling and said, well, it doesn't work. Well, the reason it wouldn't work is because we need proper trauma therapy when we're struggling with those symptoms. But counseling might be great if you're dealing with anxiety around chemotherapy, for example. It might be really good for contained things like that. And there's multiple different approaches. Mindfulness-based approaches, apart from psychology-based approaches, they have the strongest evidence-based. So it might be mindfulness-based art therapy, MBSR, which is mindfulness-based stress reduction, MBCT, which is the cognitive therapy with mindfulness. So there are different things, and a lot of them are done in groups. They're actually quite accessible online as well. A number of these programs are accessible online. And the evidence shows what meta-analysis means. It's an analysis of lots and lots of papers put together. And these analyses show that there's low anxiety, depression, fatigue, better quality of life, and even something called post-traumatic growth. And that means that actually after a traumatic event like diagnosis and treatment, actually there is some growth, there's some more resilience in the system because of all of these applications of mindfulness, or maybe breathwork or yoga or other therapies. So mindfulness-based interventions are really cool, and I know that, of course, they're being supported by target ovarian cancer as well. So do access those if you feel it will be a benefit to you. There are other things like yoga, Tai Chi, and Qigong, for example, that can also have significant benefit in managing anxiety and depression. And the Cochrane Review is basically big medical reviews that take lots and lots of papers together again and then say, okay, do we really want to be doing this? Is it supported by evidence? And in 2017 already, let alone now, we have even more evidence. They recommended yoga for supporting healthcare-related quality of life, reducing fatigue and supporting sleep, as well as managing depression and anxiety. compared to also psychosocial intervention. So just a quick reminder, if you do nothing else, actually, if you learn nothing about complementary therapies at all from this talk, just keep in mind that taking care of those 4 aspects and getting support with those if you're not sure what to do is really important. That's where all of the complementary therapies will work much better for you, and your treatment will work much better for you if you're paying attention to these 4 foundations. So let's talk about which professionals might be involved in providing integrative care. So they're medically and non-medically trained professionals. So integrative doctors, like me, for example, with additional training, cancer support, may run clinics or maybe provide one-to-one care. They're also, of course, non-medically trained complementary health practitioners or nutrition lifestyle practitioners that have a really broad spectrum of training. And it's really important to realize that even if they're registered with the appropriate professional body, you will need to check their credentials and their experience individually to make sure you're seeing the right person. And they can be private or available via charity support. So, Yes to Life and Pennybourne UK take the integrative approach in general, but specifically for ovarian cancer, of course, Target Ovarian Cancer runs a weekly yoga and relaxation class every Wednesday. And there are other events such as exercise with Can Rehab Specialist, Reflexology, Mindfulness, etc. So do keep an eye on those because it's a wonderful free way of accessing this kind of information and care. And there are many, many different therapies that might form a part of your plan. And you might find that one thing suits you more than the other. And actually, it's completely individual. No matter what the evidence says, it's great to have evidence to say that something is effective. But if you hate yoga, trying to make you go to yoga is completely counterproductive. You might enjoy Qigong more, for example. You might want to do something completely different. So please do listen to your body and what your needs are and pick something that suits you. But in general, we can maybe start with mind-body practices. So we talked about mindfulness already. We might talk about yoga, and that might include physical practice, or what's called asana, breath work, which are breathing exercises, Tai Chi and Qigong, which again are another mind-body modality. What I will cover really quickly here, and I'll cover it a little bit later, is that yoga is different to yoga therapy. And yoga therapists undergo hundreds of hours of additional training on top of, say, a 200-hour normal yoga teacher course. So, for example, I am currently training to be a yoga therapist on top of my other qualifications, and we have to do 850 hours of additional training over 2 years to become a yoga therapist, right? Your average yoga teacher in a class will have undergone 200 hours. So you can see that's a massive increase in experience, and they're trained to work with a number of complex medical conditions and medical contraindications. So again, a general yoga class may not be appropriate for someone who's suffering from significant effects of cancer or cancer treatment, and you might want to consider yoga therapy instead. Whole traditional medicine systems are the most well-known are traditional Chinese medicine, or TCM, and that includes Chinese herbal medicine, what CHM stands for, and acupuncture, for example. And acupuncture can be delivered, or you could be registered with 2 main organizations. There are others as well, but British Acupuncture Council, which is the back here, and ATCM, which is the Association for Traditional Chinese Medicine. And ATCM registered both herbalists as well as acupuncturists, and you need to do additional training. So again, in traditional Chinese medicine, training for both acupuncture and herbalism can be between 4 to 6 years. So that's the sort of amount of training that people go through. Now, when people talk about acupuncture, sometimes we get confused. What is acupuncture? I go to my physiotherapist, they do a bit of acupuncture. Well, that's a different kind of acupuncture called medical acupuncture. It really is very much targeted more about pain relief, musculoskeletal symptoms. So chiropractors, physiotherapists, and lots of other professionals within body work, they will usually use medical acupuncture, not TCM, not traditional Chinese medicine acupuncture. So it's not the same approach. They don't look at things in that way. Ayurveda is a traditional Indian medical system, which again has a number of modalities wrapped into it. Herbal medicine, so for example, NIM, the National Institute for Medical Herbalists, that's where you would go to find a medical herbalist to help you with herbal medicine. Naturopathy, there are various organizations. And body-based therapies, all of which have their own professional regulating bodies. And there are many, many, many more that I haven't listed here, because to be honest, I would have to go through about, probably 10, 15 slides just to put them all in bullet points. So find something that works for you. I've just listed the most common things that you might come across when you do some research. And here are some key questions to ask your practitioner. And one is, of course, about the professional training. What professional training have you completed? And which professional body governs your practice? Because you want to know that they are registered with a professional body. Have you worked with a person with a cancer diagnosis before? And how were you able to help? It gives you an idea of their experience, but also what kind of benefits you might expect from undergoing any particular support. And have you received additional training to work with cancer? Now, this varies hugely between different professions and different professional bodies, but it is important that you know whether someone's undergone an additional cancer training course. And if possible, maybe ask them if they're a member of SIO or BSIO. Of course, not everybody will be a member, but we do encourage professionals to join us to be able to support the best practice. And it's really important to also ask some practical questions. If you're undergoing a complementary therapy, for example, or going for a nutrition consultation, you need to outline your support needs and expectations. What do you expect to get out of it? And then you want the practitioner to give you the costs and the timelines for how they're going to support you. So, for example, am I supposed to attend weekly? Am I supposed to attend once a month? What kind of support am I supposed to be expecting? What would the cost for that be? And it's really, really essential that anything given to you orally, any supplementation or herbal medicine, it's absolutely essential that drug, nutrient, herb interactions are checked. And it is absolutely within your right to make sure you go back to your practitioner and say, have you checked my drug interactions? It's really, really important. Because again, people will vary in terms of how careful they are with that. So integrative oncology in practice, what I've flashed up on this slide, I'm not going to go over it in detail, is some of the really common symptoms that people might experience and some of the best evidence modalities within that. So for example, you can see insomnia, we already talked about CBTI, yoga, Tai Chi, for example. So it's well worth keeping an eye on this because it's important to understand there's certain things that might be helpful. So acupuncture, for example, can be helpful for a number of things, but it might not be helpful for everything. So it's important to realize that different symptoms and different side effects require a different approach. So key points of safety. And as I said, like with any conventional treatment, when you receive any kind of treatment, you need to assess something called risk-benefit. How risky is this treatment and what benefits is it going to give me? And is the risk-benefit, is that balance okay for me? And many complementary therapies are really very safe when they're done by a qualified practitioner who knows what they're doing, but not self-administered without guidance. And it's really important to make sure your medical team are aware of any therapies you're undertaking. Now, it's also important to recognize that sometimes you'll go, no, or this doesn't work. It is also up to us to do our own research and decide whether it works or it doesn't. Or if we strongly feel there is a lot of research in this area, because of the talk I've done or something you have read, bring a paper, bring a research paper or some kind of evidence summary into your consultation with you. Advocate for yourself. If you feel something is important to you, it is also important to communicate that back. I can tell you as a medical doctor, I've received 2 hours of nutrition training in my conventional medical training. So we cannot expect doctors to know everything about everything. It's just not going to work. So if there is something you feel is going to be of benefit and you want to take it to your oncology team, but they're not sure, then maybe it's the time to consult a practitioner or drop BSIO a line and saying, is there any evidence for this, for example? Can you provide me with any papers that might be useful? Then we will be able to support you with that. So do remember, we're a professional supporting organization. We're not patient-facing, so we're not able to support the person who's going through cancer treatment. We'll be able to give you evidence to be able to take to your professional team if you need it, for example. So it is absolutely essential that everybody is on the same starting point, really, and that interactions are checked. And it doesn't mean you can't use supplements or herbal medicines, but it is important that we are safety aware. And what we educate oncology professionals about, oncology teams, that actually not offering it or not being open to the discussions, because sometimes my patients will say, get a flat no. And it's not until I contact someone and maybe provide some evidence and explain what integrative oncology is that someone is a bit more open to this discussion. And what we teach is that we need to be talking about this, because lots of people, of course, will hide it because they're so afraid of the reaction they're going to get from their medical team. But then it opens you to risk, because you're going to find all sorts of information online. And it may be great information from someone who really knows what they're doing, has good qualifications, or maybe someone's personal blog, which is wonderful to talk about their personal experience. But not everything that person does will apply to you. So really do pick your information very carefully.
Okay, so working on the hands. So I'm going to chat through some points that we would use for well-being and wellness and de-stressing. So I've just picked a sample of them. What we would do, if generally reflexologists would work on the feet, unless there was a reason why we couldn't, in which case we can use the hand as a substitute for the foot. Sounds a bit strange, but there's like a sort of crossover, they act as the same thing. So the hand acts as the foot if you couldn't work on the foot. So that's the great thing about reflexology. So sometimes we give the clients some points to work. They might, have a particular problem or issue that they want, they find that they can actually do a bit of work on themselves. So the idea of what I'm going to show you now is that you can use some of these points yourself. What we would generally say to clients is we don't give them hundreds and hundreds of points, because you probably can't remember them, specifically where they are. And also you can over-treat as well. The thing about reflexology is knowing what you're doing with your treatment, and the thing about the right amount of treatment as well. An average reflexology treatment should last from the point you go in to the point you leave is probably be about an hour. Some of that will be some warm-up techniques and some cool-down techniques. So the treatment itself is probably only 20-25 minutes on each foot. It's not a huge amount of time. If you're going for like a 2-hour session, that's probably, or foot reflexology, that's quite a lot of reflexology. It's not a case of the more is better. Sometimes it's just the shorter, more focused treatment actually gets the result. Before we would do any hand points, we would do some warm-up techniques as well. And we do with the foot, we just warm the foot up, we sort of lubricate, get the foot moving, get them used to the therapist's touch, and then just see how sensitive they are. Some people's sense of touch is quite marked. So when you need to gauge how much pressure you're going to use with the client. With the hands, it's slightly different. We're quite tactile with our hands. Our feet, not so much, because they're in our shoes all day. So our hands are not so sensitive as the feet. So in both cases, we would always just, because they're quite complicated, lots of joints, lots of bones in the hands and the feet. So we would do a warm-up sequence before, doing any specific reflexology. So we've got some warming up of the hands here. So we've got hand washing. So this sort of like just general hand washing, just sort of getting the hands moving. We would rotate the wrists. I'm going to go through these later again afterwards, so you can work along with me specifically. Hand stretching, so just sort of flexing the fingers, drawing the fingers back. And then we would also get the clients to sort of massage over the palm of the hand and all along the fingers as well. So using the thumbs and the fingers just to explore what the joints are like, what the skin's like, just feel if there's any tender spots. You can also just gently release the joints as well by just rocking backwards and forwards. So we're encouraging the circulation, we're warming up the tissues before we do any specific reflexology points. So here are the specific reflexes for the hand. So I'm going to chat through them and just sort of, there's a bit of the sort of reasoning behind them. So the first one is the head reflex area. So on the hands, that the fingers represent the head. So on the hands, they're obviously much different to the foot. There is a lot more space to work on compared with the toes. So the head reflex is reflected in the thumbs, the pad of the thumbs. So we would be working down the thumbs. We could use our reflexology technique, or we can actually just slide. If we've got a little bit of sort of lubrication, a little bit of hand cream or something, then you can actually just slide down these reflexes. You don't necessarily need to use this specific hand walking technique, because you can still feel if you've got any changes in the tissue. It should still be discernible, if you're sliding. So we've got the tips of the thumbs, which represent the head reflex. So if you think what's going on in the head, lots of things. So you've got all your sort of brain structures, all your cranial nerves, lots of things going on in the head. So people with busy brains, heads that sort of always buzzing, the head reflex is one of the key ones. So you've obviously, now the way that reflexology work is that you imagine that you are sort of split down the middle, if you like. So your right hand and your right foot, so everything on the right hand side represents the right hand side of the body, and everything on the left represents the left side of the body. So you're sort of split into two halves, if that makes sense. The other area we've got is the brain reflex. So the brain is reflected in the tips of the fingers. It's also got the tip of the thumb, but it's also the tips of the fingers as well. So sometimes it might be easier to work like that, or sometimes reflexologists can use a knuckle, just to knuckle over that reflex area. So the brain reflex. So again, it's that sort of calming, looking at these structures in the brain area, because overthinking, trying to not desensitize, but just sort of switch off, patterns of if you are overthinking, too much thought, can't switch off. So the head area, brain reflex, really important. Another key one, which reflexologists always use, is the pituitary. Pituitary is the master gland situated in the center of the brain, but it controls the endocrine glands. So it sends out messages from the anterior, posterior, pituitary lobes to work on endocrine hormones. So it's a key one. If you often look at people's feet that are highly stressed, probably not so much in the hand, because again, the hands are more in contact, but pituitary glands can be seen like popping out. It's sort of a real indicator of a stressed client. So that's another one. So we can knuckle into that one, or we can just use our finger to rotate. The other one we've got is the neckline. So the neckline is at the base of the thumb. So the neckline is another great one. If you think of all that sort of tension in the neck, it's a good one to sort of release. And you often find when you walk across this reflex here, there is a lot of crunching going on. But the idea is that you would just keep working and just sort of work it a few times, and you probably notice that actually that crunchiness starts to diminish a little bit. So the neckline, think what necks are like. If you're driving a long time, you have that, the neck is in the position for a long time. They need to just loosen our necks and release the tension from that area. So neck one is another great one to work. And then we also have the shoulder reflex. So the shoulder reflex on the hand is located at the base of the fifth finger. So again, what we would do is use the thumb, and we can just slide over this one. I'll try and do this bit later on, do some different views so you can see. So right shoulder, left shoulder. So we're going to work just sliding into that reflex. And again, this is another one that might feel a bit sort of gritty as well. Just explore what that that reflex area feels like there, because again, shoulders, if our neck and our shoulders, all that sort of circulation in that area is a bit restricted, no wonder we sort of feel a bit tense and a bit tight. Another great one we've got is the adrenal gland. So adrenal gland is very much associated with the stress response, has other roles as well, excuse me, in the body. In order to find this one, we're going to use the webbing of the hand, and then we're just going to use our other hand just to pinch in that webbing. So the reflex area is actually located here. Now this one can be quite tender, so before you start pinching later, just check and make sure, just feel into it, just feel what it feels like first before, going for it. So the idea is that we would find that tender spot and then just sort of rotate on it and just see what it feels like. The thing is to sort of sit and, hold the reflex and then just see how it makes you feel when you work it. You know, sometimes just really focus that intention on that spot and see what it feels like. The diaphragm really important. You know, diaphragm is essential for, you know, deep breathing, oxygenating properly. Often when we do a reflexology session, you know, a warm-up session, we would work the diaphragm line just to encourage relaxation, deeper breathing in the client, you know, get them into a more relaxed state before we then started our reflexology session. So our diaphragm line basically sweeps across the palm of the hand. And again, to work this, we would either use our thumb walking, or again, you can just sweep across. Another way is to sort of rotate across. We'll look at that a bit later. And then you find any little areas that feel a little bit tight. Again, you can just rotate on them and then carry on. So the diaphragm, really important for deep breath, you know, proper oxygenation, really inflating those lungs. You know, you're oxygenating not just your lungs, but your other body tissues as well. And then the last one that I put in is the spine reflex. Now, on the hand, it looks completely different than it does on the foot, because obviously you've got a much longer foot. So it's what we call a medial reflex. So it travels down the inside of the foot. So you'd find it on, the feet, you'd find it on the medial side of both foot. So you work it on both sides because it's a central reflex. On the hand, it literally runs from not the top of the thumb, but just where the thumb bends. That would actually be this occiput area here, and then it runs down the side of the thumb, around the bottom of the palm, and then to the edge of the hand here. So you're actually traveling through cervical, thoracic, the lumbar, the sacrum, and the coccyx on both hands. So you make sure that you work, I won't say both sides of the spine, because they're not two sides of it, but just the entire spine, that you work the entire spine. So these are the key reflexes that we're going to look at. And then I say, you don't necessarily have to do all of them. And if you were going to work them, what you would do is pick some reflexes and work them probably up to 5 minutes. No, not much longer than that, not each individual, but in total. So you can spend, you know, half a minute doing one, half a minute doing another. It's better to do little and often, so a couple of times a day, than spend, say, 20 minutes doing, you know, a big session. You know, it's just sort of something you can sit and do, you know, when you've got some quiet time, just sort of, you know, focus and explore those reflex areas. So our first thing we need to do is just warm up our hands, just lubricate this hands, get some nice energy flowing in the hands. So the hand washing, so again, just rotating the wrists, washing the hands. Nice sort of hand washing movement. Then we're going to rotate the wrists. So rotating the wrists clockwise. So this is sort of lubricating all these little wrist joints here. So clockwise, anti-clockwise. And then hand stretching. I've got a technique here where basically you're going to interlace the fingers and then just sort of stretch the wrist one way then the other. That doesn't look very, so, that's better. So one way then the other. So just sort of stretching all the joints a little bit, and just go with what's comfortable for you. Don't ever force it in reflexology. No, it's just gently loosening up. You might find later on that you've got more mobility, but initially it's just that initial warming up. We can also stretch, flex the fingers. Don't do it that way. Yeah, up and down. It's a bit weird, but there we go. So stretch and flex those fingers. Hand stretching. And then we're going to massage the finger joints. So using the thumb, going to massage the palm of the hand. So massage all over the palm. This bit here, this thenar eminence, is always, some people always have a little bit of tension there. That's so really just see what that bit there feels like. Just explore that thenar eminence. And then over the rest of the hand. So when you're massaging over this part of the hand, what you've actually got is your you've got your diaphragm line here, but you've got the chest area here. And then in the lower portion of the hand, you have the digestive reflexes. So you have your upper, lower digestive reflexes. You have the stomach, various sort of digestive reflexes, slightly different from one hand to another. So that's what you're working on when you're massaging. That's the reflex areas when you're massaging over the palm of the hand. So I'm going to change hands now, just massage. Again, that thenar eminence, just see what that feels like. Massaging over the palm of the hand. So again, if you find any little areas that feel a little bit sort of tender, again, you can just use the thumb just to sort of sweep through them. Okay, then we are going to massage the joints. So we're going to just take our fingers and just work our way up each finger. So that way. So I'm just using my fingers just to sort of almost like just roll up, just sit and just exploring around the joints, just see what they feel like. And I just do the thumb as well. So I'm just using my fingers just to massage along the length of the finger. So starting from the base and working up to the tip. So you start on the thumb that side. Massaging from the base up to the tip. And this one. And then I can just, if I want to work specifically a bit more on the joints, I can just place my thumb and my finger either side of the joint and just sort of rock backwards. So my fingers are sort of rocking backwards and forwards just over the joint, just to give the joint a little bit more, just working the joint a bit more, to see what those joints feel like. So nice and gently, just work those joints. And then actually one thing is to pull each finger gently, So travel down the length of the finger and just a slight traction at the end of each finger. So I just pull down and just a slight bit of traction on the end of each finger. Again, just loosening up those joints. And just a slight traction. That's it. Okay, so our hand should feel really supple, ready to go. Lots of blood pumping in them, should feel nice and warm, got a bit of warmth in them, circulation through them. The joints feel nice and mobile, ready for our reflexology points. So the first one then, let's have a look at this one, the head reflex. So the head reflex is in the top of the thumb. So what we are going to do, I'm going to do it this way. So if I was thumb or finger walking, it's basically just like a creeping forward. That's the way to, we often refer to it as a caterpillar walking. That's what we sort of use with our, but what reflexologists develop is a sort of sensitivity in the tip of the finger. So as you're walking through the tissue, you can just detect the sort of changes in the tissue. So that's the fundamental movement. It's just like a caterpillar walking. So I'm going to walk down the front of the thumb. Might be easy if you're sat at a different angle, just trying to get the best view on the camera. So walking down the thumb. So I'm going to cover as much of that thumb tip as possible. So don't leave any bits not done. And then I'm going to slide down. So I'm just going to slide down from the top. And then I'm going to do my other one. So again, I'm just going to use my finger just to do this little caterpillar walking. slide down. Slide down. As you slide down, to see if you can notice any sort of areas that don't feel, it just doesn't feel as uniform, I think is the way best to describe it. Okay. The brain reflex. Okay, so we're going to use the knuckle to work the brain reflex. So the brain reflex is right in the tip of the thumb. So I'm going to take my knuckle, and what we do is we use a sort of like the whole surface of the knuckle. There are occasions where we sometimes tip the knuckle slightly and use the edge. That's quite intense. That can be quite a firm pressure, but we're just going to use the flat of the knuckle. So if I were just to plonk my knuckle down, that's what I'm using. I'm not sort of tipping it and using the corner of the knuckle. So I'm going to take my thumb, place it on the tip of my thumb, and then just rotate. It's probably easy if you're sort of down a bit. I'm just going to hold it up. Just and then actually rotate slightly, slight rotation. Swap hands. So I'm going to do the other half of my brain. Ooh, that feels a bit different. A bit crunchy there. Obviously got some. Right. Just see what that feels like. So a little rotation, just see what that feels like.
The other demonstration I'd like to do is something called Soften, Soothe, Allow. It's completely up to you whether you want to do this exercise. It's a way of noticing when you're feeling difficult physical feelings or emotions, and rather than going that autopilot, just seeing how you can gently hold it. Some people find this exercise really helpful. Other people, they start it and they think, oh, this is way too much. That's fine. You can stop at any time. But what I'll do is I'll go through it with you and just see just seeing if how you found it. It should take about 5 or so minutes. But if you do feel, what I would say is if you do feel a bit emotional, that's completely normal. And if you want to stop at any time, that's absolutely fine. So again, if you want to just settle into a comfortable position, and if you feel comfortable doing so, just gently closing your eyes, and just bringing your awareness to the level of physical sensations, just noticing the sensations of touch and pressure, where your feet make contact with the floor and your body makes contact with the chair, just noticing those sensations. And again, just focusing your awareness on the changing physical sensations as the breath moves in and out of the body. And what I want you to do is just noticing that feeling of the breath flowing freely in and out the body. And what I want you to try and do is just quickly scan the body from the head to the toes and just noticing if you can feel any physical sensations that feel related to your emotions. For example, if you felt a bit anxious or feeling a little bit anxious or tense, you may be able to notice how that emotional experience presents itself as a physical sensation. Some people feel anxiety or tension as a tightness in the chest or throat. If you're not noticing anything, that's fine too. But if you do, just bringing compassionate attention to this place, and just, if you can, just feel yourself softening into that space in the body. Imagine this to be similar to applying warmth to stiff or sore muscles. And just let go physically forcing anything at all. And in your mind, if you are feeling any tension, and there's a physical sensation with that tension, what I want you to do is just repeat the word soft in your mind with the soothing rhythm of the breath. We aren't aiming to suppress or avoid any experience at all here. We are simply bringing mindful and compassionate attention to our emotional and physical experience in this very moment. Just stay with this process of softening for a few moments. So again, you can just imagine this to be similar to applying warmth to stiff or sore muscles. And the next step is what we can do is just in your mind, as you're noticing the breath, just gently repeating the word soothe in your mind. And you may also choose to imagine that experience of warmth or soothing or kindness arriving at that place in the body where you felt your emotion physically affect you. Just noticing your breathing, not trying to change anything, but just remaining with this process of soothing for a few moments. And as a final step, if you can, just consciously letting go of any need or urge to get rid of your emotional experience. As you exhale, letting go of any effort to avoid or suppress any emotion. Don't need to push any of these feelings away. You can just allow this emotion to be where it is and for it to come and go in its own time. This time, silently repeating the word allow in time with the soothing rhythm of your breath. You may even choose to repeat the words soften, soothe, allow in your mind as you follow the breath during the last moments of this exercise. Your mind may wander. At times you may find it's a bit overwhelming to stay with this experience, that's fine. Or you may find that you're drifting off and relaxing. It really doesn't matter. You're in control. Just staying with the breath for as long as you need. Just resting in the soothing rhythm. Just directing mindful and compassionate attention to your emotion. And then, when you feel ready, just letting go of the exercise, being aware of the physical sensations of touch and pressure, being aware of the sounds in your environment. Just opening your eyes whenever you feel ready. So that exercise, I do that a lot here at Marcus with people, and I get really mixed responses. Some people find it really helpful. Other people just find it quite difficult or a bit overwhelming. It really doesn't matter. But any exercise where you're moving away from that autopilot and are just aware of, okay, this is how I'm feeling, I'm just going to sit with that for a few moments, can make a huge difference.
So mindfulness is the awareness that arises. You can do that now, actually. You can pay attention to your feet on the floor, just the sense of contact between the soles of your feet and the contact that whatever they're touching, the shoes and the floor itself, on purpose. So that's intention. You're intentionally paying attention. It's not just happening because there's a strong smell somewhere or somebody's knocked on the door, but it's actually deliberate. You're paying attention on purpose because you meant to. Yeah, in the present moment. Well, it's very hard to pay attention if it's not in the present moment. You know, we can't really pay attention to the sneeze that we had yesterday or the thought that we're going to have tomorrow. But in the present moment has a sort of immediacy to it. So that's quite useful, really. And non-judgmentally, which is almost impossible, actually. You know, you look at that blue and you might think, oh, I like that blue. You look at the pink of target ovarian cancer, or the sort of, I don't know what colour it would be, the sort of purpley pink colour. You might think, oh, that's a bit bright, or oh, I really like that colour. I'd like a blouse in that colour, or scarf in that colour. So non-judgmentally, you know, we're often judgmental. So that's quite difficult to get away from, really. Yeah. So any of you who paint, any of you who garden, any of you who wash up and just really notice the colour of the cutlery and the crockery that you're using, the smell of the bubbles, the smell of the soap, liquid soap that we use. Those of you who enjoy cooking and who are really present as you cook, perhaps present as you chop the vegetables, perhaps, or as you stir the soup or bake the cake. I mean, I think that the arts is a particularly strong association with mindfulness, because I remember a friend of mine was on an art course, and she was painting a picture of the local castle. I used to live in North Wales, and she described to me, and when she came back, she was staying with me that evening, she described to me how she really got completely absorbed in the colours of the grey stone of the castle, and the kind of you know, the way it was made, and the construction and the shape of it. And it was clear that she said she'd had such a wonderful day. She felt really calm and settled because she'd been so absorbed in her painting of this castle, which actually is quite a dull grey castle. But she was so engaged with it that she was really mindful. And what's interesting is that when we're really mindful, we're very settled, actually. I don't know if any of you can think back to the last time that you were really absorbed in something like gardening. I mean, we can garden with our minds thinking about something else. That's not particularly mindful. But if we garden really being aware of the colours and the soil and the feel of it and the smell of it and you know, all of that, and be really absorbed in what we're doing, then we're mindful. And the mind then doesn't have the chance to wander off. Or if it does wander off, because we're quite engaged, it'll come back again. So now I'd like to invite you to, we're going to do a little kind of guided imagery exercise, which again, you can follow if you'd like to, but you don't need to if it doesn't sound something you'd like to do. But as you sit here, perhaps imagining that you're sitting beside a lake or beside a river, perhaps, but beside a body of water. You're sitting quite safely on the bank. You've got one of those nice camping chairs, perhaps, or you're sitting on a nice firm rock or stone or something that just keeps you quite safe. But in front of you, you can see the water, and the water's very clear. You can see all the way down to the bottom of the river or the stream, or perhaps all the way down to the bottom of the lake. And then what I'd like you to do is to imagine, if you'd like to that you could pick up a little pebble that's just beside your seat, and you could just gently toss it into the water. And I want you to imagine that this little pebble is going to travel down through the water incredibly slowly, much more slowly than it actually would. It's almost like weightless. And you can watch it as it goes all the way down. So as you watch your little pebble moving down gently through this clear water, just inviting you to ask yourself a question that you could almost drop into yourself, almost drop into the insides of you. What is my intention for this session? And just watching that little pebble go down as you let the question just drop into you. What is my intention for this session? And then as the little pebble goes a little bit further, you might sort of deepen the question and actually ask yourself, well, what is it that really matters to me? That this session, this mindfulness taster session, might support? What is it that really matters to me? that mindfulness might support, that this session might support. And just notice as you drop that question in, as you watch the pebble move down through the water. Just notice perhaps some words or some images, some faces, some thoughts or ideas. And perhaps just breathing with them, not worrying too much if you've got an answer or if lots of words come or if no words come at all. I often find that the deepest intentions are often not particularly full of words. They're almost like a feeling in the body, a felt sense, sort of something that rings true. Even if we'd be hard pushed to explain it. And now as the pebble moves down through the water, where it's coming towards the bottom of the lake or the bottom of the river, coming to rest, perhaps on a sandy area or perhaps to join some other stones down at the bottom. And then when you're ready, just gently moving the body so that you come back into a sense of your feet on the floor, body on the chair. And when you're ready, opening your eyes. Okay. And just inviting you to just reflect a little bit on that intention. Just to notice what that experience was like for you. If we were in the same room together or even on a Zoom screen, all of us together, we could just have a little conversation about what you got in touch with. Certainly I do that practice quite often. I find it very helpful, actually. I've had my granddaughter staying with me overnight, which is a great pleasure. And I just think to myself, if I asked her what really mattered to her, she would come up with a very different answer to mine. You know, if I asked myself that question in my 20s or 30s, it would be very different to the answers or the connections that I would make now. So it's a good question, isn't it? That it's a good question, and it's one that we can connect with, that actually really helps us stay true to spending time in a way that matters. Because it's so easy to lose time. It's so easy to, I don't know, do all sorts of things that waste time. Yeah. So setting an intention in mindfulness is really important. And really the context that we're in makes it even more important, doesn't it? I mean, you have the context of cancer. I have a context of cancer too, not active cancer. And we have all sorts of other factors that probably are touching your families, you know, economic situations, job prospects, and so on. So there's an awful lot going on. It's also, I want to introduce you to a practice called a pause. Again, this is something that's, you know, very straightforward, very easy to do, often quite hard to remember, but very, very easy to do. So I'm going to guide you in a pause, and let's do this with eyes open. So we don't always, when we're doing a practice, have to close the eyes and sort of go inside. It's important to be able to do it on the hoof, if you like. The pause is just an opportunity to stop. So whatever you're doing now, just even if it's thinking, or just stopping, pausing, and asking yourself the question of what's going on for me right now. So what's going on for me right now? What's going on for you right now? So let me give you some things that you might be aware of. So you might be aware of sensations in the body. You might be aware of the contact of your seat, of your body with the seat. You might be aware of the touch of your hands, perhaps touching perhaps a desk in front of you or on your lap. What else? You might be aware of the touch of your clothing. So it might be a physical thing that you're aware of. So you might pause and just notice something physical. You might be aware of some pain or some discomfort. Or you might be aware of some thoughts. So you might be aware of thinking, this is better than I thought, or no, she talks too much, or whatever. You know, and inevitably I'm going to talk a lot, because otherwise, you know, that's the point really, isn't it? You know, so you might have a thought that very often our thoughts are sort of commentaries. They're sort of not exactly judgments, but they're often thoughts about, I like this, or I don't like that, or I wish this was more or less, or, yeah. So often our thoughts sort of pull us towards what we want or what we don't want. But they might be sort of shopping list type thoughts. Oh, I must remember to get some milk tonight before tea. Yeah. And then the other thing that you might also check in on, and I'll make this also quite brief so that it's not too complicated, just check in on mood. So if you were to just pause and ask yourself, what's going on for me right now? What would be your mood? Is it flat, or is it engaged? Is it bright? Is it sleepy? Is it sluggish? You know, no judgment needed, just noticing mood. So this pause, we've taken a few minutes over it, but this pause can be incredibly brief. So it's just a chance to stop, notice, ask yourself the question, what's going on for me right now? And then just check into the body and thoughts and mood or feelings, emotions. Just be noticing what's going on right now. I suppose what might be quite helpful is just to focus in on the fact that mindfulness can be about really a one-pointed focus. So let's just practice that a little bit. And it can also be a sort of wider awareness. So just as you're sitting here, I'd like you to look around the room. I'd like to invite you to look around the room and see what you can see without having to move your body. And then choose something that you can see in front of you that you kind of like the look of. Maybe it's a picture, maybe it's a view out the window, or maybe it's an ornament, but something that gives you pleasure when you look at it. So really looking at it in some detail. So perhaps noticing aspects of what you're seeing. Just this, you know, quite a specific thing that you're looking at. Notice aspects of it, perhaps the color, perhaps the shape of the object you're looking at. Perhaps if it moves, or if there's any kind of light, perhaps shining on it or through it. And just as best you can, really looking at the detail of this object, whatever you're looking at. And just noticing what it's like, that there's a lot of detail to see, even if it's a very small object. Probably detail you may have never noticed before. Okay, so now widening your kind of frame of seeing, if you like, and just with the object that you were looking at, just take in the context around the object. So perhaps move your eyes so that you can see what's to the left of it and what's above it, what's to the right of it, and what's beneath it. So we're just going wider, a wider awareness, and you can go even wider if you want to almost the periphery of your vision. So even if you let your gaze just soften, you'll see that you can, even without moving your eyes, you can see quite a long way to the left. And just play with this, and you can see almost up to your eyebrows. Perhaps the ceiling of the room, depends on the tilt of your head. And if you go right, or if you keep your head straight, but if you go to the periphery of your right vision, you can probably see shapes. And then also to the bottom periphery. So you can get an idea of a sort of wider awareness of all that you can see, even with your head still. And then letting go of that. Just letting go of that and coming back to your feet on the floor, if that's okay for you. Just coming back to a sense of contact between your feet and the floor. So letting go of what you were looking at and what you were seeing, and just connecting back into just your feet. Just the weight of your body going down, feet, perhaps in the shoes, perhaps in some socks, And then a sense of the solid, perhaps of the floor beneath your feet or beneath the shoes. Okay, and then letting that go. And thank you for those of you who wanted to follow that. I hope that was interesting. So I'm going to tell you about what my experience of that little practice was like, and that might give you some in perhaps to your own. So I was looking at a favorite picture of mine, which is a picture of a blue heron that a friend sent me. And I was noticing some feathering, some detail of kind of feathers I've never noticed before, actually. Just on the painting, it's very lovely, actually. I also noticed that I don't think I'd seen so clearly before, but the heron's feet and bottom legs were in the kind of greyish bit, sort of creamy grey bit, as if it was standing in water. And I also noticed that there's a little signature up in the top corner that I hadn't noticed before. So even though that picture is very familiar to me, very, very familiar, I often look at it. It sort of holds memories and pleasure and friendship there. I actually noticed things in that picture that I'd never seen before. So that was really lovely, actually. I really enjoyed that. And then I widened into the context. And I was surprised how far my peripheral vision went. So I could see a little way into the window to the side here. And I could see quite a long way around, and really just looking at the context, I noticed how wide my awareness can go, actually, if I concentrate, if I pay attention on purpose in the present moment, without judgment, in an open way.
Find out what it's like to do some origami. There's nothing like doing it. So grab yourself some paper. Got some, I just figured most people would have A4 paper. If you have A5 paper, like a pad, that's perfect actually, because we're just going to use half a piece of paper. So actually my 3 rules for origami. My first rule is be really exact. If you start well, it continues well. Start badly, it gets worse and worse. So it's attention to detail, but we'll go very slowly. And when we go slowly, it's relaxing. My second rule is give good, strong folds, because the folds actually give it the strength. If it's loose, it starts to unravel. It's also relaxing to add really strong folds. So you use your fingers. If you have nails, you can use them. If you don't, it doesn't matter using your fingers. My third rule, it's not really a rule, but just remember it's meant to be fun, so don't take it too seriously. And if you do something that's different, hey, you're an inventor. So that is actually the way to invent things. So I'm going to grab something to press on. We don't even need scissors, but it will be really fun, I think, to decorate these pieces. So I'm just going to take the A4 piece of paper. All I'm going to do first of all is just basically divide the paper in half, because we actually just want an A5 piece of paper. So I've lined up those corners nicely. I've given a good strong fold at the back there. And as I said, it's quite relaxing adding that nice fold. If you like things to be kind of neat and tidy, this is a really nice thing to do. I think also we feel stressed when things are out of our control. So doing something very controlled really helps bring a little bit of order to our minds that we need. And it's just paper. So I folded it in half. Now, if you've given a good strong fold, then you should be able to give a little tiny nick. And then hold your hand, do this definitely on a solid surface, hold your hand close to that edge, and you should be able to tear that off. Just go carefully and slowly and keep your hand close to that edge. There we go. I've ended up loving this sort of slightly torn edge. This, you can see the little fibres there of the trees. It's the word origami means, ori means fold and gami means paper. And paper is a very precious material. So we're actually just going to use half our A5 paper, so we're going to divide it in half again. And actually over this time, as mentioned, I've started experimenting and inventing my own. It's such a, just seeing where things take me. It's great fun. Things might not work, but does it matter? Maybe it will work. Maybe something you didn't expect could emerge. So again, I'm just dividing this A5 paper. I guess it's now becoming A6, isn't it? So here we go. I'm going to use just one of these for now. Put your other piece aside. So, because I think this looks nice and small actually. So we've got now, it looks like a little mini A4, it's a little A6. And we're going to make a square. So much origami is based on squares. The second fold actually won't be, but we're going to make a square. And this is good experience for you to know how to make your own paper to use for origami. So we're going to take a corner and we're going to bring it down, lining up. I guess it's that short edge and lining it up along the long edge. I was saying to Alice actually last week, I was invited to go on BBC Radio 5 Live and teach origami on the radio. It's very hard. And I might teach you at the end what it is that we made. So anyway, if we lined it up, even something like this can be tricky. So we're now going to remove this rectangle. So we're going to turn it over, lift up this little flap and bring it back, lining up carefully and pressing it down. Again, just take your time, enjoy the feel of the paper, that we're doing something in our hands together. It's not just watching a screen, you're doing something. Looks a little bit like a Robin Hood's hat. So we just want to get rid of this rectangle. So I'm going to turn it over. And again, a little nick there along our very strong fold. And again, put your hand nice and close to that edge. You should be able to just gently tear that off. You could obviously cut that off, but actually, if you do a good strong fold, the fold and the tearing is actually quite accurate. So you should have a square with a diagonal fold across it. So as we've got it, we opened it up. It looks good. Now we're going to do the other diagonal, but just a pinch in the middle. That's all. So we're going to take those corners. I recommend you do it on the surface. I end up doing it in the air because it's a way I can say hello to you at the same time. I'm lining up these corners and I'm doing a little pinch in the middle. There's so many things you can do with origami. That anyone has paper, and then opening it up, and it's showing you a halfway line. That's all. Okay, so we're going to get making now. Feels like what we've done is a few folds. We're going to take the top and we're going to bring it to the middle point. So taking that top, and you can see where that halfway point is. That's where you're going. So this is a traditional fold, and it's lovely to think that this has been passed on through generations. It would be from Japan. And actually, yeah, I was reading about the philosophy of origami. I really love this idea. It's about honouring the paper. You're taking your time and your care. I think as well, when you're taking time and care, you're taking time and care for you, and that's really needed. I don't know about you, but I find it hard to relax by not doing things. I need to do something to relax. So anyway, we've got our point in the middle there. Next step, we're going to take the very bottom point and bring it all the way up to the top and keeping it in the middle. So we're taking that bottom point and bringing it all the way up to the top, keeping it in the middle. And when you're happy it's in the right position, squashing down at the bottom there. Okay, I've kept it a mystery as to what this is, haven't I? It's deliberate. I like a little bit of surprise. There we go. So it's looking sort of wider at the bottom. Soonish you'll start to see what it is that we're making. So we're going to take this lower side and we're going to take this side and bring it up to the vertical line. I'm not going to say lefts and rights because it can be a different way around, but we're going to take one side, doesn't matter which side, and then bring it up vertically along that line. And squashing it down. Could still be many things, couldn't it? There we go. So all nice and lined up. That's it. Brilliant. Lovely. So as you've got it, we're going to take the other side and do the same thing. So this lower side, we're going to bring up to that vertical line. I think you'll start to see what it is we're making. It's been my favourite fold over this time. There's nothing like seeing everybody holding their hearts together to make you feel a little bit happier. Great. Thank you. So it looks like a heart, but it's a bit pointy, isn't it? It's a bit pixelated. Let's soften our heart. So to do that, just take the top point and then fold it back. There's a top point, folding it back. And the same, just tucking it away. No one needs to see the back, do they? So the top points, but the sides are still looking a bit pointy too. So it's the same thing, taking the side and again, just tucking it back a little bit. And there you have got hopefully a beautiful heart. And this is something obviously nice to put up, to remember to care for yourself. It represents your self-care time. Maybe be nice for gifts. Yeah, excellent. Shall we have a quick decoration of it as well? Yeah. So practicing earlier, I was just playing around. You could do, very gently shaded. Here I just started scribbling with almost half running out felt tips, and it worked really well. So I recommend or maybe words in there that could inspire you. Words that could motivate you, things that are important to you, or just doodle and add colours that you enjoy.
Thank you again for joining us and making it such a wonderful session. We hope to see you again soon and hope you enjoy the rest of your day. Thank you.